Okay, this is chapter 13, recognizing different sports injuries. I like that picture because it's a overhead squat, part of the functional movement screen, FMS. And to do that correctly, you got to have a lot of strength and flexibility. It's a really good, it's a good test, good indicator. So if you want something fun to do, check out that functional movement screen, and you can actually take classes and get, I don't know, I guess certified or something. I'm not sure you need to do that, but there's some really good stuff involved with that. Okay, so chapter 13, this is some of my stuff just kind of added in. This is definitely going to bridge the gap before we start doing injury evaluations. Some information that you need to know. Here's some terminology for it's important. We'll use a lot. Atrophy and hypertrophy, these are two opposite words. The prefix a means without, and trophy refers to muscle, and hyper is excessive. So atrophy, this is muscle that we're talking about. Atrophy happens when something's, well, first of all, the muscle becomes weaker and smaller, and it happens due to lack of use. So maybe an immobilization, a casting or a sling, surgery. It'll happen with injury, lack of use, and sometimes people don't exercise, they don't move much, so muscles will atrophy, get smaller and weaker. Hypertrophy is the opposite, muscles bigger and stronger, and of course this is always our goal in rehabilitation, is getting athletes especially, or anybody, stronger and body working better, especially with rehabilitation. A ligament, by definition, connects bone to bone. It provides, its function would be stability. It stabilizes the joints, and we will learn a lot of ligaments in this class. Every time we cover a joint, we'll go through the common ligaments that are often injured and keep these together. So when you injure a ligament, it's called a sprain. That terminology is coming up, I think, here soon. Oh yeah, it's on the next slide. So sprain with a P, S-P-R-A-I-N. Okay, muscle. A muscle is, well, what does it connect to? It moves, its main job is movement. And, obviously it's anchored down via the tendon to bones. And again, its primary job is to move, but also functions as a secondary stabilizer for joints. When the muscles contract, they can help just increase that stability, especially when we're talking about some of the more unstable joints, knees, can happen with ACL injuries, shoulders, any joint. So tendon attaches muscle to the bone. When you injure muscles and tendons, we call it a strain, S-T-R-A-I-N. And then bursa, these are they're kind of like little fluid-filled sacks, little baby pillows. And most of them function just to prevent friction between maybe tendons and bones, those kind of structures. When tendons are kind of moving back and forth, the muscles contracting, a bursa will help prevent the fraying, kind of like a rope fraying over an edge of a piece of steel. It's similar with this, they'll protect those tendons from irritation. Okay, so acute injuries. So here's some things we want to talk about with acute injuries. First of all, a definition of acute is a sudden onset injury. So you know exactly, you have a specific MOI, you stepped in a hole, or hit or contacted. So that's an acute injury. We're going to have the opposite. It's going to be a chronic injury. It's the next slide. And you can see a nice ankle sprain there with the ecchymosis, the discoloration, swelling. So it's a nice photo. FX is a fracture. There's several different types of fractures. A break is a fracture. Some people think they're different. It's the same thing, but there are different types of fractures, and I'm sure a book goes into those. We're not gonna go over those components, but sprain is an injury to a ligament. There's 3 grades, and strain is about the same, 3 grades. A grade 1 is a mild injury, which has stretching of the tissue, no tearing, A grade 2 would be a partial tear of the tissue, and a grade 3 would be a complete rupture, which often results in surgery or requires surgery to fix. So again, sprain is ligaments, strain is muscles and tendons. You can strain a tendon or a muscle. Same grading system for a strain, grade 1, 2, 3. Dislocation, we don't have grades for the rest of these injuries, just sprains and strains. Don't have grades for fractures. Dislocation is when the joints come apart. A lot of joints commonly dislocate: patellas, which is your kneecap, shoulders, fingers. You can really dislocate any joint in the body. If you dislocate a joint, since ligaments stabilize and keep those joints together, that you know that you have a ligament injury associated. So oftentimes those joints will continue to be unstable, and sometimes require surgery to get them repaired and tightened back up. Treatment for dislocations, I mean, I'm sure I will go over it again, but we do not put things back into place until they've been x-rayed and a doctor puts those back in. So if you have a dislocated joint, which we often come across in athletic training, there's important liability legal issues to knot until we rule out a fracture. Subluxation is a partial dislocation, so the joint comes out, but it goes back in, so it looks normal. It looks fine, but it has, the athlete might report something like it feels like it came out and went back in. So subluxation, partial dislocation, but it looks fine. And a contusion is fancy for a bruise. That's direct impact. So that, even though the ankle in this picture looks like a bruise, it's not a bruise, it's a sprain. Tearing of the tissue resulted in the same kind of bruising, but it's not a bruise. Okay, chronic injuries. Chronic is a repetitive overuse injury. I also like to think of it as an under recovery injury, because the body's amazing, and if you gradually introduce it to activity and movement, it will adapt and adjust. But sometimes if you're doing not enough recovery, it just doesn't have enough time to repair, and it will break down. You can only swim so many miles a day, times per day. So our running and swimming typically, and throwing and overhead, a lot of those movements are repetitive. And there's just several examples here. It looks like I didn't like my tendinosis spell check, but that is spelled right. For tendinitis and tendinosis, you get rid of that O for tendon and replace it with an I, so spell check's off. Tendinitis is an inflammatory condition of a tendon. Most current research is showing that most tendinitises that we thought was tendinitis is actually tendinosis. Osis is the suffix means abnormal condition, so it's just more of a micro damage breakdown of the tendon. And that's important just because it helps us dictate how we treat that injury, not treat it as an inflammatory injury, but treat it as something different. And that's coming here on one of the slides. Tenosynovitis is pictured here. It's a little sheath, synovial sheath that the tendon goes through, the little tunnel. Sometimes that gets irritated. Bursitis, those bursa can get inflamed, and osteoarthritis is the joints, most commonly the knee and the hip. You can actually wear down that articular cartilage that goes on them and create some pretty bad problems. So there's a few terms there. Let's see. Okay. I'm not going to talk much about this because it's pictured for you. I've tried to get this all in 10 minutes and I'm getting kind of close. I have one more slide. You do need to know this. This is super important information. Just because, if if you have an acute injury, you know what's going on at each phase, it's going to help you figure out what you need to do to treat each phase. So usually your initial phase inflammatory response, you're trying to control swelling, so your prices, think of your prices, you're icing, you're compressing, you're elevating, trying to minimize that damage. Phase 2, scar tissue formation, you might be working more with heat, ultrasound, so some of the other modalities that we're going to get to soon. Scar tissue, when tissues damage, scar tissue is going to form. It's a good thing, but it can be a bad thing as well. So we want it to form, but then in that third phase, that maturation remodeling phase, that's when we often will go through and do some soft tissue mobilization, trying to keep that scar flexible, elastic, so it will mimic regular tissue and not scar tissue. And medication help, any of the above, of course, anti-inflammatory medication would help with that first phase. Most doctors will recommend an anti-inflammatory medication, which would be like ibuprofen products, aspirin products, Aleve, those kind of things. So, okay, last one. Getting kind of close to my time. This is the last slide. Signs of inflammation. This is a straightforward list. Probably don't have to talk too much about it. You can see the swelling there. If you have just swelling, that'll increase pain. It just puts pressure on the nerve ending. So you could have swelling with no injury, which typically doesn't happen, but you will increase pain. Warmth to touch, oftentimes palpation, you can actually feel it. You might have loss or reduced function. That's usually because of the pain and just the pressure on the nerve endings. And then redness. Sometimes you'll get redness. Oftentimes not. It's a little less common, I would have to say. Okay, that is this section. So thank you.